Starting with their top story, former Gauteng Health MEC Qedani Mahlangu has broken her silence, saying she will take accountability for the deaths of mentally ill patients in the Life Esidimeni tragedy. The number of fatalities has been revised upwards to 143. In a statement, she denies having fled the country to avoid testifying at the arbitration hearings that are currently underway. But she will only avail herself in mid-January to state her case. The emotional impact of the deaths came under the spotlight again today.
To trauma and torture is pervasive and vast, and I have never seen levels of trauma like this, ever.
A clinical psychologist painted a picture of broken and traumatized families. Their loved ones died from, among others, starvation, dehydration and hypothermia after being moved to unlawful NGOs. The health ombudsman took the stand for a second time. He initially tallied the deaths at 118, but now says 25 more people died after the release of his report.
By the end of September, which year? 2017, there had been 4 additional deaths, which brings the total to 143.
Takalani Home in Soweto had the highest number of fatalities at 38.
If we had looked after these mentally ill patients, we wouldn't be sitting here.
The centre, the former health MEC, is yet to answer for her decision. In a statement, Mahlangu criticised the media for suggesting that she'd been dodging the process, and she insisted that she would testify when her studies had been completed.
Mahlangu will testify before these arbitration hearings, and the dates that are agreed upon are the 22nd of January next year, 2018, running through to the 26th of January 2018.
Last week, the global banking school in the UK suspended Mahlangu over the controversy. Mahlangu's lawyers intend to challenge the suspension, saying it was incorrect and unlawful. But the families are furious at the delay. A subpoena will now be sent to Mahlangu to appear at the hearings in January next year. Criselda Lewis, SABC News, in Parktown, Johannesburg.